Good afternoon or good morning, depending on what time zone you're in. And thank you so much for joining our panel discussion today on equity and smoke-free housing and how a social justice approach shaped a model smoke-free multi-unit housing ordinance. I am Marissa Katz. I'm a staff attorney at the Public Health Law Center, and I'll be moderating today's discussion with our panelists. A few words about the Public Health Law Center before we get started. We are a nonprofit legal center housed at Mitchell-Hamline School of Law in St. Paul, Minnesota, and located within the traditional homelands of the Dakota people. Our commercial tobacco control teams are made up of attorneys, policy analysts, and support staff. We provide free legal technical assistance on local, state, federal, and tribal commercial tobacco control policy issues to the general public, organizations, and governments nationwide. At the center, we take an equity approach to public health policy. We believe that effective policy is equitable policy, especially when it comes to public health and when it comes to commercial tobacco control policy. We believe one-size policies do not fit all and consider it our responsibility to use our legal knowledge to bring justice to public health as we support our partners in reducing health disparities. Housing, of course, is one of the crucial social determinants of health. Stable housing is vital in aligning with other social determinants of health. So the last thing we want to do is place people's housing in jeopardy when smoke-free housing policies are implemented. That's why the policies we help craft ensure that eviction is truly a last resort if used at all. And finally, the attorneys at the Public Health Law Center provide free legal technical assistance. This includes providing legal research, policy development, publications, and trainings. What we do not do is provide direct client representation, nor do we engage in lobbying. And for everyone's reference, the Minnesota Smoke-Free Multi-Unit Housing Model Ordinance can be found on our website at publichealthlawcenter.org, and the link will also be listed in the chat during this webinar. So let's go ahead and meet our panelists, all of whom played a critical role in working with Public Health Law Center in crafting the model ordinance. Their contributions of time and expertise helped shape a comprehensive policy that reflects diverse backgrounds, voices, and perspectives. Natasha Phelps is Director of Equity-Centered Policy at the Center for Black Health and Equity. Prior to joining the center, Natasha worked as a litigation attorney at a private defense firm and as a lead senior staff attorney at the Public Health Law Center, where she provided legal technical assistance on commercial tobacco control and equitable public health policy issues to public health professionals and organizations, legal professionals, and advocates throughout the United States. Natasha also serves on the board of the Planned Parenthood Minnesota, North Dakota, South Dakota Action Fund, and taught as an adjunct professor at Mitchell-Hamline School of Law. Bridget Simmons is a staff attorney with the National Housing Law Project. Her work focuses on the preservation of HUD-subsidized multifamily housing, healthy housing, voucher use, and tenants' right to organize. Bridget joined the National Housing Law Project in September 2017 as the second David B. Bryson Fellow. As the Bryson Fellow, Bridget managed the editing process for the 5th edition of HUD Housing Programs, Tenants' Rights, also known as the Green Book. Bridget is a 2017 graduate of Georgetown University Law Center and a 2011 graduate of Florida A&M University. Kara Scan serves as a program director with the Association of Non-Smokers Minnesota, also known as ANSWER, and as project director for Minnesota Prevention Resource Center, also hosted at ANSWER. She has over a decade of experience working on housing, environmental health, health equity, and substance misuse prevention issues. Since 2011, she has worked with ANSWER's Live Smoke-Free team to promote, implement, and sustain smoke-free housing initiatives locally and nationwide. She holds Master of Social Work and Master of Public Policy degrees from the University of Minnesota, Twin Cities. And last but certainly not least is Kate Ebert, who serves as the Health and All Policy Specialist at the City of Bloomington Public Health. She graduated with her Master's of Public Health from the University of Wisconsin-La Crosse and has worked in higher education, drug policy, and mental health promotion. She lives in North Minneapolis with her family and enjoys the abundance of hiking and biking trails nearby. Thanks to all of our panelists for your participation today. And before we turn our discussion panel-wide, I do want to turn it over to Kate and Kara, who will briefly provide some background information on what led to the Minnesota Model Ordinance.
Great, thank you. Good morning, everybody. So to give a little bit of kind of context for where this project originated, the city of Bloomington, Minnesota is located just south of the metro area, St. Paul, Minneapolis. We're the fourth largest city in Minnesota. We have a large hospitality industry. The Mall of America is here. We have a lot of healthcare industry as well. And we had been doing voluntary smoke-free housing work for over a decade, utilizing our SHIP, our statewide health improvement partnership funding, which comes through the state and is focused on chronic disease prevention work. So we've been doing this work for a long time. And then prior to COVID, our council had asked us for more research, data, policy options related to some additional tobacco policies, both point of sale and housing. And so after some years of community engagement and surveying, we started exploring the creation of this equity-centered smoke-free housing ordinance. And that work was also funded by SHIP, as well as a one-time grant from Blue Cross Blue Shield. So that gives you a little bit of context of kind of where we're coming from. And happy to pass it on to Kara to talk a little bit more about the background.
Great, thank you, Kate. Next slide, please. So as Kate mentioned, the policy that we're ultimately talking about, and also the Equitable Enforcement Advisory Committee, came out of quite a long process of community engagement. Starting back in 2017 to 2020, there was some extensive surveying of multi-unit housing within the city of Bloomington. During that time, 920 households representing 16 multi-unit housing properties were surveyed. And they were asked a wide variety of questions ranging from experience with exposure to secondhand smoke, any health impacts from that exposure, if that existed, opinions about smoke-free policies in the building where they live, and also more broadly in the community, so ordinances, disclosure policies. So of those surveys, 725 were in smoking allowed properties. That survey process was followed up by a number of different listening sessions. So a listening session was held with 5 property management companies representing over 1,800 units. A listening session was held with 5 affordable housing advocates who work in and around the community of Bloomington. And there were also a number of key informant interviews that were held with multi-unit housing residents representing 15 households. So I'm going to add a little bit of an asterisk here. So a lot of these listening sessions occurred right in the thick of kind of the start of the COVID-19 pandemic. So we had to be kind of creative with how those listening sessions were held. For example, the resident listening session was shifted to be key informant interviews over the phone because of pandemic restrictions. So there was a lovely report that was created with all of the kind of themes that came out of those listening sessions, and that really helps kind of build this work that we are talking about today moving forward. Next slide, please. So on the right hand of the slide here, there are 3 of the residents that participated both in the resident one-on-one interviews and also graciously agreed to participate in our video series that we created in partnership with multi-unit housing managers and residents from the city of Bloomington. Those videos can be found at the link on the screen. They're listed on the Bloomington City website, and they were promoted via a social media campaign that was really targeted geographically and by zip code to Bloomington as a whole, but also certain kind of zip codes that had high proportions of multi-unit housing within the city. As I mentioned, the lessons learned from working with all of those different groups and communities within Bloomington helped us inform that Equitable Enforcement Advisory Committee, which I will talk about in just a moment here in an upcoming slide. Next slide, please. I just wanted to highlight a few of the themes that came out of the listening sessions, specifically the listening sessions and the one-on-one interviews that we had with residents and advocates. So, there was broad acknowledgement that there are both health benefits and challenges pertaining to smoke-free housing policies. It's broadly recognized that secondhand smoke is a barrier to healthy housing. There was concern that a smoke-free housing ordinance could lead to evictions or become a barrier to accessing housing. Broad consensus that the focus should be on compliance and not enforcement. And when enforcement is utilized, that equity really and housing stability really should be at the core of those, of that effort. And also clear communication. A lot of residents felt like their, policies were kind of put on them. They weren't involved with the process, and they also weren't always clear as to what the policy details were. So clear communication throughout the process was key. So the Smoke-Free Multi-Unit Housing Equitable Enforcement Advisory Committee, of which we have the pleasure to have a number of those folks with us today, really came out of those listening sessions and those themes, and Bloomington Public Health staff and also Answer and Public Health Law Center wanting to dive deeper into some of those themes and also concerns about equity that were brought up in those listening sessions. The initial committee that we had, the intent was to have the entire committee be from the city of Bloomington. And what we found pretty quickly as we were, jotting down a list of the different perspectives we wanted at the table was, unfortunately, all of those different kind of perspectives and groups didn't all live within the confines of the city of Bloomington. So pretty quickly that list grew to expand beyond the city of Bloomington to the 11 wonderful participants that you can see on the screen here. So we had folks from representing different backgrounds, including affordable housing, legal aid, restorative justice, addiction, and public health. Next slide, please. In all, there were 5 full group virtual convenings. Again, this all occurred in the thick of COVID. From December 2020 to March 2021, it was really important to us to acknowledge both, people contributing their time and their expertise to this process. So honorariums were provided to participants throughout this process. And our goals really were to identify unintended consequences of a smoke-free multi-unit housing ordinance, promote the goal of compliance. So it was important to us, again, we don't want to promote eviction or seek fines for residents or focus on criminal penalties. We really want to focus on how can we promote compliance. A part of that was supporting access to cessation resources. We also wanted to identify out-of-the-box enforcement mechanisms that protect health and housing security. So, for example, utilizing housing inspections or the health department and not law enforcement in the enforcement process. We also wanted to consider the pros and cons of various policy approaches, prioritizing the resident's perspective, and again, promoting housing stability, which is also a really key component in this. Next slide, please. Our very first convening, we wanted to focus on, what are our committee values, both as individuals, but also from the organizations that we're representing. So here's a screenshot from one of the slides that we collectively, pooled our brains together to create. So, as you can see, there are some common themes of caring for those we work with and for, focusing on empathy, compassion, kindness, trust, and respect, advocacy, so social justice, equity, and health justice for people of African descent and other Black, Indigenous, or people of color, access to healthy housing. So we want, housing to be safe, including safe air to breathe. We want to focus on tenants' rights and responsibilities. And we also want to address inherent disparities within the justice system and acknowledge the impact of stigma in this role as well. Next slide, please. So all of that, those great discussions, those 5 convenings led to the creation of the model equity-based smoke-free housing ordinance. So the Public Health Law Center had the heavy lift, so many kudos to them, with input from Bloomington Public Health staff and Live Smoke Free to review all of the feedback and create a draft policy. The committee, as a full committee, was able to review that draft policy twice, once in 2021 and in 2022. Again, we provided honorariums throughout those 2 meetings as well, because we really value people's time and expertise. So with that, I think I'm going to turn back to Marissa. I just want to give a plug again today. We're not going to go in detail with the policy details, but we are going to focus on really the process that led us to that policy. And then there will be a follow-up webinar that goes more into detail of the specifics of the policy at a later date. But looking forward to the conversation. Thanks, Marissa.
Great, thank you so much, Kara, and thank you, Kate, for those introductory remarks. So turning to the panel, let's go ahead and address really and thinking about the policy considerations that were made in crafting the ordinance. And I will point out that the model ordinance does cover implementation for both rental properties and common interest communities, such as homeowners associations, townhomes, and cooperatives and the like. So with the policy considerations, I'm wondering, what was your approach and understanding of public health more broadly and its specific application to smoke-free multi-unit housing?
So I'll jump in first. As mentioned before, my name is Bridget Simmons, she, her pronouns, as staff attorney with the National Housing Law Project. And just by way of background, the National Housing Law Project is a national organization based in San Francisco, California. We provide technical assistance to attorneys who represent low-income families, both renters and homeowners. We provide policy support at the federal, state, and local levels, and we bring impact litigation. Essential to our work is our administration of the Housing Justice Network, which is a national listserv of attorneys, advocates, and housing advocates throughout the country. And it's just really a great opportunity to see how the Black letter law plays out differently, and in some cases the same, in communities throughout the country. And so in regards to this, our work in this space, several years ago, HUD implemented a smoke-free policy in public housing. And so that's where we kind of entered the space, right? So HUD proposed this rule, and we wanted to be sure that the rule really honored the fact that folks who are supported or assisted by public housing and other federal housing programs, that they face a great deal of housing instability if they lose those subsidies, right? And so the direct question about like our understanding about public health and how we view public health. So one, we as housing advocates, and in particular being from the tenant perspective, we understand, and I think collectively during the pandemic, we have realized that housing is a public health issue, right? Increased evictions cause housing instability, and unfortunately for many folks who either become evicted or somehow otherwise lose access to housing, there's a high risk of possibility of them becoming unhoused. And we know the difficulties associated with assisting folks who are unhoused getting rehoused. We also know the associated detriments to health that are associated with folks being unhoused. And so I really appreciated in this conversation that we had this expansive definition of public health, acknowledging that public health harms also includes those associated with evictions and homelessness, as well as kind of described a little bit earlier, about the harms of over policing and the traumas of that, right? And that is really important I thought it was really impactful to hold those thoughts and those memories as reflected, or holding those thoughts and those principles as reflected in the other earlier slide that Kara shared, that we had these broad but very specific shared values. And that exercise was really good because it allowed us to not only identify shared principles, but then to also have conversations about, like, what does that mean to minimize evictions or not to use evictions as the first initial enforcement tool? Like, what does that look like? What does it mean to incorporate restorative justice and to make folks feel heard and accepted and understood? Like, what does that mean in practice? And so I really enjoyed even before talking about any mechanics of the policy, we talked about how we view this work and started from a place of shared understanding, which I thought was super important, especially in times where there are the tensions between how do you enforce? We traditionally enforce doing these things. Well, let's look at a different way. Like, what new world can we create in thinking about these new laws that we pass in regards to housing?
Great. And I think, just kind of following that thought and that process and the key policy decisions that were then implemented into the model ordinance, I'm curious to hear more about, the prominent role that local public health has played in the model ordinance. And Kate, perhaps you can speak to that in terms of the importance of local public health and their inclusion in implementation of this policy.
Yeah, absolutely. We know that not every community has the same resources, but with this kind of comprehensive model policy, we wanted that role of local public health in there because I think recognizing kind of the unique relationship that local public health departments have with community, but also like regulations with inspections, with kind of our models of family home visiting or medical case management, right? We have a lot of those tools and resources and processes already kind of built into the work that we do. So recognizing kind of that unique role that public health can play, where enforcement and compliance doesn't have to come from law enforcement. It can be more of that restorative justice. It can help guide people to resources, cessation support, if that's what they're looking for. But we have a little bit more of that capacity. That's not always what communities have, but again, if we can kind of model that in the policy, each community can look at kind of their unique assets and resources and fill in, some of those roles.
Yeah, that's great. And I think on the flip side, of course, is, the also included in the model ordinance as a policy consideration was the right of tenants who are exposed to secondhand smoke. And because of neighbors who are violating the policy. I'd be interested in hearing more about, part of putting that into the policy, of course, was just making sure that, they're not trapped in a lease if nothing's happening, and no one should be exposed to secondhand smoke, and certainly in you're living in housing that in which you have that policy in place and the right to smoke-free housing. And does anyone want to speak to that and implementing that provision in terms of lease termination?
I just want to speak kind of to the higher level of that question, and then I'm sure maybe Bridget has some more specific procedural input. But, when we started this process of gathering this Equitable Enforcement Advisory Committee together, there were so many things, like Bridget said, that we were hoping to talk about that would allow us to create something completely different. This idea of what could some alternative enforcement provisions look like. And it just so happened that we're working on smoke-free housing, but really this is a practice in having these conversations for many different public health regulations. And one of the things that we knew we needed to do was to talk about the process and the available means of enforcement. So Kate referencing public health's involvement with enforcement, Bridget mentioning the idea of reimagining who is involved and at what point. We really wanted to make sure that we had addiction and behavioral health experts in the group, that we had restorative justice and mediation experts in the group. And we really wanted to address the fact that, a public health law center where I was working at the time when we were doing this, we were receiving so many TA requests, either from, individual tenants or from landlords themselves, that either already had policies or were interested in creating a policy in which it was a first strike you're out type smoke-free housing policy. And so it was either first striker out, or there were severe penalties quite early on, because a lot of of the landlords that were contacting us did not want to deal with the idea of having to mediate an issue between neighbors where there was secondhand smoke exposure. And so we saw this as an opportunity, yes, to create rights, like you mentioned, Marissa, for people who are exposed to secondhand smoke exposure, not even just for them to engage in conflict with their neighbors, but to be able to exit a living situation which was detrimental to their health, sometimes in a critical fashion. But then also creating this new enforcement mechanism in which, the first, second, and even third response is nowhere near the idea of eviction or any type of severe penalty. And so that to me remains important to this holistic approach to policy, in which you want to balance all of the determinants of health at play, which Bridget already went over, so I won't. But I think this idea of having this new world, this new concept, is not only to reimagine what enforcement looks like, but also to provide exit strategies for people who just want to be done if there are issues with enforcement, or if they just want to avoid the conflict, much as you see with other types of provisions that allow for tenants to be able to break their lease because of some type of activity happening at the property. So that, I think, is really important to consider what this will avoid when it comes to privately created and implemented and enforced smoke-free policies that we know are happening around the country with landlords. So.
And then if I could just speak really quickly to the recommendation about giving tenants who are impacted by secondhand and thirdhand smoke the ability to break their lease or to terminate the lease early and to move. So I believe that was a suggestion from one of our colleagues or one of the participants in the conversation, who is actually a legal aid attorney in Minnesota. And I believe it was based off of Minnesota state law on a different topic. I believe it was in regards to survivors in domestic abuse, their ability to break their lease. And so I just flagged that to say, once again, to this notion of reimagining this world, there is something in law. It could maybe be refashioned for smoking. And so that's what we thought about, right? So also, in addition to thinking about what's new, how can we redo this? Also thinking about what was done and how it can be refashioned to, progress equity considerations in the future. I would also say, I really appreciate that this made it into the recommendation or into the plan, because it also serves a very important piece of empowering a tenant. We spoke very early about oftentimes folks who are impacted, they go through the process of reporting it, they follow up, right? And they may feel, because enforcement can be, it could be, it could be tricky. That's not necessarily the word that I wanted to use, but it can be complex. It can require a lot. And for whatever reason, folks are not necessarily communicating back to the person reporting issues. And so that person reporting issues may not see anything. And so they might think nothing is happening. And if that is the case in that situation, the tenant then doesn't have to, as Natasha say, sit in this situation. They have the ability to say, this is no longer what I want, and I have the opportunity to find something better for themselves, right? So, market conditions are gonna really have an influence on how easily folks can just pick up and move and relocate. But I think that's a really important aspect in terms of empowering folks who are reporting issues with smoking in the building.
And just to add one more thing about that, the timeliness of the discussion, I think, is really important, because, when we were having these discussions as a committee, obviously we're still in the pandemic, and we were really in the pandemic, when we were having these discussions and talking about people who were currently experiencing respiratory issues like COVID, and now seeing the amount of people who are suffering from long COVID, as the idea of this, the disabling that's happening as a result of the pandemic, having things like, this, like an out for residents to be able to remove themselves from situations that are not safe for them, that could be detrimental to their health and critical to their life, is helpful also too if there is a mutual benefit for the property owner and for the tenant, if there are any ADA issues that might be involved with that. I mean, there's many different aspects to the things that we talked about that we really wanted to center and focus on equity and health equity and tenants' rights and protections, but we did consider the things that came up with the city of Bloomington in their engagement also with property owners. And there were many things that were very beneficial to those who were living in multi-unit housing as renters, that also could, if you went a little bit deeper and really thought about the potential issues that could come up with exposure to secondhand smoke, where there was a lack of implementation and an inability, lack, or disinterest in enforcing it, that you had that kind of catch-all release from your contract with the property owner that could have been mutually beneficial. So I just wanted to say that we really considered a lot of different aspects when we were talking about these different enforcement mechanisms.
Oh, thank you. I think I'm going to sort of incorporate some of the audience questions that are related to this point, so we don't lose the conversation thread, because it's really important. But I wanted to raise a point that someone asks with the housing shortage, some tenants that are experiencing secondhand smoke don't have the choice to move out, and really do face limited choices, particularly in the context of affordable housing. So how would you meet their needs or target this group of people?
So I've been talking a lot, so I'll just say shortly, there are other enforcement mechanisms in the model. So I know throughout our conversation, we spoke about administrative enforcement from the city in regards of the city holding the owner responsible for enforcing the smoke-free policy. There were conversations, as mentioned before, about restorative justice practices, incorporating that into enforcement, in particular, if this is at the beginning or one of the first or at the beginning stage of the allegation process, right? To find an opportunity or to create an opportunity for where there are some shared values amongst the committee or the community, and for folks to understand how their behavior is harming others. That is not just you can't smoke here because we don't like smoking, that it actually has a real detriment onto their neighbors. So a lot of this, in addition to centering equity, is also about building community, right? And what does that mean? It's about building trust amongst folks, building familiarity, building understanding, identifying shared values, identifying where there are tensions, but how to work through those tensions. And so I would say, like, kind of going back to your initial question about the expansive definition of public health, we never want to see someone, especially folks who are pretty susceptible to secondhand smoke. Of course, all of us, there's no benefit to secondhand smoke, but for folks who are particularly, I said I was going to talk very shortly and then I just started talking, but we never want anyone to experience housing instability. But in the current housing model that we have to do the best that we can in terms of keeping people in their homes and finding alternatives to eviction to resolve housing issues and conflicts between neighbors. I'll just stop there.
Let's talk a little bit more about, or I'm sorry, go ahead, Kara. You were going to chime in, I think.
Oh, no, Bridget, you made a great point. I was just going to really build off of that and say, we had a lot of conversations with the group about that tension between protecting clean indoor air for all, right? Not just non-smokers, but for smokers too. And then also protecting housing stability. And so how it's a tricky balance that isn't always going to look the same. Again, I want to just give a plug for our next webinar where we go more into the details of the specific policy, but there are, to Bridget's point, a lot of parts of the policy that focus on making sure that everybody's successful, so that our end goal for everybody is clean indoor air and a healthy home for all and housing stability for all. So we're not trying to exclude folks. And so some of the tools that were mentioned, restorative justice, really focusing enforcement from a public health lens, using education supports, mediation services, cessation supports, really saying, what's the challenge? Why are you struggling to, abide by the policy? What are the challenges you're facing? And how can we help you be successful living within the policy within your own home? So it's a pretty multifaceted, we had lots of conversations about this, excited to talk about it more in the second webinar, but to Bridget's point, yes, it's a fine balance that we had a lot of conversations about.
And I just wanted to say, I can see in the questions and in the chat, there is confusion about, well, is the only recourse in the model that a tenant can break their lease? No, there are multiple aspects of the enforcement of this policy. The link is in the chat box, but if you look at that, there is an enforcement process for the person who has allegedly violated the ordinance. There is an enforcement process for the actual property owner. And so if you take a look at that, you'll see that there's a multi-pronged, multi-step approach, and it looks different depending on who the alleged violator is. And if it is a resident, for example, there is a holistic approach where there is contact from public health, as Kate mentioned, and it goes all the way up from a day fine, which we'll talk about later in the next webinar, all the way to having a mediation where there's buy-in of all participants, cessation resources provided. I mean, it's a very holistic approach that eventually can lead to things like required fines, and if you so choose to include enforcement. And so this is not just a one-stop, you can get out of your lease. So just take a look at that or join the next webinar for more details. But I just wanted to make that very clear because I think there's a little bit of confusion.
Thanks, Natasha and Bridget. I think also just talking a little bit about the issue of proof, which I see has also come up in a few places in the chat or the Q&A. And Kara, I know you've addressed this in previous presentations before, but anyone on the panel is welcome to chime in, of course, which is just if you are someone dealing with secondhand smoke, thirdhand smoke issues, it's really the issue and the struggle of, how do you prove something that you can't see and, or the air that you breathe is harming you. So if you have any kind of practical on the ground pointers for someone who's in that situation, and maybe you could just give a few examples of what's worked in the past.
Sure. Yeah. And so I'd say this is just generally with smoke-free housing policies, not specific to this ordinance or the process. But we, Natasha said this too, public health law center receives a lot of calls. I know the city of Bloomington, we receive a lot of calls, and people generally don't know how to handle, I'm being exposed to secondhand smoke, what do I do? So just kind of a few general things that we recommend. And it's not a perfect solution, but it's really kind of building the case. So, we usually start with, can you create a secondhand smoke journal, if you will? So record the date, the time in your apartment where you're experiencing the secondhand smoke, and really, build the case. Have you talked to your manager or if you feel comfortable, your neighbor who might be, where the secondhand smoke might be coming from? There are a lot of tools and a lot of great organizations on the ground that can kind of help you through this process. We do a lot of trainings with property managers to talk about, what can be considered evidence. So things that are out in the open, if there's a routine entry into a unit anyway, you can't open someone's, for example, closet or drawers or anything, but if there's evidence of smoking that's out in the unit anyway, that can, be counted as evidence. So there's a number of different things. Some managers actually include in their policy language exactly what will count as a violation, which can be really helpful, again, for kind of clear communication to all parties involved in terms of what will count as secondhand or a violation to a smoke-free policy. So there's more information on this topic on our website. I don't want to divert us too much. I know we have limited time here, but mnsmokefreehousing.org, we have a lot more resources for residents who might be suffering from secondhand smoke exposure.
Great, thank you, Kara. And I want to circle back to the restorative justice piece of the model ordinance. And if one of you can just kind of provide a little bit more in-depth overview discussion about what is it, what does it mean? And, for example, all parties must agree to be involved in the process for it to be implemented. And does local public health play a role in a restorative justice process?
Well, I'm not an expert. I'm not a restorative justice expert by any means. I do have experience working in restorative justice. And then, of course, we have restorative justice experts, mediation experts in our committee. So the information that I'm telling you is based on that experience. But what, to my understanding, when it comes to restorative justice, the idea is that you're acknowledging that community actually can come together to resolve issues that come up. And so it is very different from the way that we have our justice system in the United States on a state and local level, in that there is a dictator of truth, or there is somebody who hears both sides of the story and then adjudicates on an issue. The idea of restorative justice is more communal approach in which parties that have a vested interest in the outcome are involved in the situation, and the way in which you get to a point of healing or a point of resolution looks very different than, say, being in a courtroom. And so the idea that you would have in a smoke-free violation situation where you have a neighbor who is exposed to secondhand smoke, then the alleged offender, and then you have the other people who have a vested interest in the situation. So that would be something like the property owner who has with this ordinance, a legal responsibility to enforce the policy. You also may have public health there to be able to be there as a support for the purpose and intention of the ordinance that was violated. And really, it's important to have restorative justice experts and then other community members that are there and can provide support to really lead, again, to a solution. And this approach was important because we really needed to acknowledge the fact that, yes, as public health experts, we really know that one asthma attack caused by secondhand smoke exposure, having secondhand smoke exposure when you're currently in, bed suffering from, RSV or COVID, that alone can really exacerbate the temporary health condition that you have, a chronic health condition that you have, whatever it is, it can really be detrimental to your health. It can lead to stroke and all of these other things that really put somebody in the hospital. And this is a really serious, time-sensitive issue that we need to deal with. And at the other hand, we really understand that there is a huge concern over the things that Bridget mentioned in the beginning of the conversation, which is the ability of people to be able to have housing, which is also extremely critical to a person's health. We also want to acknowledge the methods of criminal justice in this country don't always tend to be fair. And so, how is it that we can create something where we're really, really basing it in science, we're basing it in public health concern, but then we're also acknowledging that the current way that it's set up is not working. And so bringing in these restorative justice components into the enforcement aspect of the policy was our answer to do that. And if you look at that, there are options for navigating that process, the main thing that we as public health people wanted to ensure that we incorporate is the connection of cessation resources and information to those involved. And so we know that a lot of people who do smoke do so for nicotine addiction is extremely difficult to treat. It's extremely difficult to maintain cessation. And so we don't want to miss the opportunity to be able to provide that support, so that is what actually can stop the violation from occurring. And so if you look at the process that we have in place that is built off of a restorative justice model, that was our solution to make sure that the person who is experiencing secondhand smoke exposure is being heard, and that we're actually truly in a holistic way working towards a solution versus just, again, like I said, first strike and you're out eviction. The other thing I want to mention is that this is very specific, obviously, to your jurisdiction. And I think that the idea that these policies necessarily lead to eviction is something that we are not saying that that's what happens. And I think it's important to understand whether or not that's happening in your area. But it is something, regardless of whether it is actually happening or could happen, we want to ensure that we are paying attention, that we are avoiding any discrimination, and that we are actually, like I said, providing people who do smoke and may have violated the policy with the resources that they need to actually treat their nicotine addiction, which we know is truly the actual way to end secondhand smoke exposure.
Thanks, Natasha. I think just sort of circling back to what was brought up earlier this hour was the really using the HUD smoke-free housing rule that's been in place now with public housing units since July of 2018. What do we know about how, I mean, that rule's been in place now for a handful of years. So what do we know about how that's worked, and particularly with respect to the competing or the competing interests or tensions between enforcing a smoke-free housing ordinance and the desire to not evict people who do violate that ordinance?
Yeah, so I would say that we don't know much outside of that it is being implemented in public housing spaces. I would imagine that some of the frustrations that many have voiced in the chat and in the Q&A, many public housing residents also face those same issues, despite a smoke-free policy, a federal requirement, I might add, being placed on these properties, right? Folks are still running into issues with management, maybe enforcing, maybe not enforcing, the issues in regards to differing levels of enforcement, right? So PHAs had the ability to develop their smoke-free policy. The federal government just said, you know, stop smoking. These are the 25 feet with a radius around the buildings. That's essentially what we're telling you. You just can't smoke in the buildings. You can't smoke 25 feet from the building. Everything else you should fill in for yourself. And so that means that these PHAs, to a certain extent, have varying policies. There are some key consistent features. Like I said, you can't smoke in the building and you have to be 25 feet from the building. But HUD didn't say to PHAs that you have to have a designated smoking area on your property so that people who do smoke can have a place to, you know, engage in this, what is still legal behavior. Some PHAs, frankly, on their public housing properties, the parcel itself is not big enough to have a designated smoking area. And so really, like, kind of broadly, what do we know is that we have this smoke-free policy in place. It's intended to do all of the things that a smoke-free policy is intended to do, but there are still some troubles. I would say kind of at a higher level, some of these troubles are because of HUD's oversight and enforcement. Owners and PHAs in the multifamily space, private owners are encouraged to have a smoke-free policy, but they aren't required at the moment. And so HUD's tracking of PHA's enforcement of the standard, I'm pretty sure is lacking. I am guesstimating because I know that their enforcement procedures for their condition standards are lacking. And so really this, you see this vicious cycle of who is enforcing what, right? And you have to have HUD present to make sure that PHAs are doing their job, and PHAs have to be present to actually enforce those policies. But, I think PHAs are doing that to a varying degree. And in some areas, they're doing really well. Like when we had our conversation about the public housing smoke-free policy, we invited Cambridge Housing Authority to the table, who actually implemented a smoke-free policy before it was required, and they've had success. They've been able to do the education with community, get community buy-in. They at the time reported that they hadn't evicted anyone for smoking. And so I think you have some areas, some PHAs that are doing really well with their enforcement. They're being very thoughtful about their smoke-free policies. And then you have some jurisdictions or PHAs where the smoke-free policy is bare bones, and they may or may not be present enough to even enforce it. And then I would also say, we're talking about centering equity today in this smoke-free policy. And I would say that the HUD smoke-free rule doesn't center equity, because they essentially use eviction as the tool for enforcement. Granted, HUD's guidance does encourage PHAs to use other strategies before pursuing eviction, but ultimately in the final rule, that's the enforcement tool.
And I'll just add to that. And I know there have been additional questions about kind of eviction more broadly, and that's something I know not just here in Minnesota, but is a struggle kind of tracking that and researching that more broadly for a number of reasons. So, I think what we and a lot of folks across the country know about eviction and smoke-free policies is largely anecdotal. Here in Minnesota, we have heard of I've been doing this for over 11 years now, and I've heard of maybe one or two situations where there was smoking involved and there was eviction, and there tends to be other, again, compounding variables. It's not solely based on smoking. So unfortunately, there isn't good research for a lot of complex reasons, which we don't have really time to go into today. But I will say, something from again, public health lens and bringing it back to the ordinance process that we're talking about today, is that we really want to focus on how can we front load, prepare, engage with the folks who are going to be impacted by the policy before the policy goes into effect, because then the policy will be more successful in the long term. So Kate added in the chat the importance of engaging local public health, local organizations like the Lung Association, Minnesota. We also have Answer, state health departments who have a lot of resources and can help properties be successful with the implementation of smoke-free policies and helping residents be successful. So that's something that was very prevalent in all of our listening sessions. It was prevalent in our committee discussions too, is that how can we provide a long timeline for implementation, really make sure that the resources are there to prepare residents, to prepare property managers, to prepare other stakeholders in the community who might be impacted by this, and make sure that everyone is prepared going into the policy. As Kate said, we recognize that that's not always feasible in all communities and that funding can be in short supply. But in an ideal world, again, enforcement will be less of a challenge later on if you do that prep work early on and really engage folks initially.
So I want to just spend the last few minutes and, we have tried to incorporate a lot of what's been put in the chat or the Q&A over the course of this discussion. And to the extent we, didn't get to your question, we do have them on record now, and we will circle back and address your questions. But I do want to spend the last few minutes sort of talking about just the lessons learned during this was a multi-year process, and a lot of thought and effort and time was put into it, dealing with some really, really difficult, complicated issues, right? So I'm curious to hear from the panel about, what, if any, opportunities do you feel might have been missed during the process of crafting this ordinance? And, are there ways in which you feel this ordinance could have been better?
I think it's, First of all, I just wanted to say that the creation of this model ordinance was with Minnesota in mind. So it's something for everybody on the webinar to think about. I know there were some questions about the legality of certain measures. And so some of that is based on our, the analysis of Minnesota law. The other thing to keep in mind is that what like I said, we had been receiving complaints or outreach from property owners, from tenants, in which when we review their existing policies, so often it was this one strike, you're out, and it was very much eviction focused. And so when we started to look at a model policy, we did so because not only we received just so many requests to review these individual private policies of these property owners. But then also we wanted to make sure that cities, counties, and it hasn't gone to state level, but this is a local ordinance to provide the protections that we know were not only needed for people from secondhand smoke exposure, but then also for things like eviction and discrimination. So that was the purpose of us even thinking about doing this model. And the city of Bloomington gave us an opportunity to fund the discussion that is so badly needed before you engage in policymaking like this. And so rather than us taking the approach of just writing it and either begging for forgiveness or just getting a sign off from some major national organizations about it or whatever, we knew that because of the potential detrimental effects of this ordinance, that we really needed to have a discussion that we haven't had before. I guess if I had to say a regret of not working this policy, it would be that the conversation, we could have had much more conversation, much more involvement. I really liked the group that we put together. I think that they represented different sectors that had a vested interest. And like I said, the process piece was covered because we had the restorative justice and mediation aspect, but we tried to put something together. And I would always say when we were doing this, that this is our first shot at creating this reimagined enforcement mechanism that in public health in general and commercial tobacco in general, we hadn't yet done. And so when you're talking about new concepts, new ideas, when you're really trying to avoid this and avoid that, you're going to have pitfalls. And the best way in public health to avoid those pitfalls, avoid unintended or negligent consequences, is to involve the community, is to make sure that their voice is at the table. I know the city of Bloomington did a lot of work to try to ensure that they did that, and I was really impressed with Bloomington compared to many other jurisdictions that we worked with, and we tried to do that as well. But there's still discussion that can be had, and I don't think that we're saying that at least I'm not thinking that PHLC is saying that the model ordinance language could never change, that this is it. But this is, to me, a very, very good shot at trying to recreate something that we know had been causing problems. And so I do believe that it's important to continue the discussion, to evaluate the impact, to evaluate what's currently happening. Like I saw in the chat something about a study done in, I think, Massachusetts about eviction and smoke-free housing, which looked to be minuscule, but still inequity in that. So I think, again, just not saying that, no, this is it, we know how this is done, and there is no other discussion. That didn't really happen, and I hope that doesn't happen moving forward, because I think it's an ongoing and evolving matter. But I do think this is the best that we did and could do, and I do think it's much different and better than everybody doing their own thing and people being impacted inequitably. So I'm sorry I talked for a very long time about that, but.
Oh, thank you. So we are at time, but if any of our remaining panelists want to chime in on that point, please do so, and then we will conclude. We'll go a few minutes over, but yeah, please feel free to chime in with any additional thoughts on that.
I just want to flag that I put in the chat a couple of resources about evictions, right? So no one is under the impression because evictions is not the the first tool of enforcement, that suddenly the issues that we have with our eviction system will no longer be problematic. I think our intent in this conversation was to not add to systems that curb folks' access to decent, safe, and affordable housing in the future, right? So in understanding the impacts of evictions, even if the case is dismissed, even if an eviction is not, if a person is not found to have violated their lease or the judge hasn't ruled to evict them, having an eviction filed on your record, we know dramatically decreases housing stability for folks who are looking to secure housing, in particular, if they're low income folks, if they have other particular considerations like re-entering a community, previous experience with the criminal legal system, folks who have a disability, families who are large, right? Like all of this impacts folks' access to housing. And so when we're talking about how to enforce any housing policy or law, we have to be mindful that our current housing structure is inequitable. We have created a housing system where we treat certain people better than others. And we congregate certain people in particular communities, oftentimes poor people of color live in communities that are divested. They also have heavy uses of industry, which also impacts their health. So all of this is interconnected. So it's really important to do this across this work across sectors.
Great. Well, a big thank you to everybody who participated. Big thank you to our panelists, Natasha, Kate, Bridget, and Kara. And thank you to our audience for joining us for this past hour. I hope it was helpful. And again, we will be doing a deep dive into the model ordinance, the actual provisions themselves at a later date. So be on the lookout for the email blast for that. And have a great rest of the day, everybody.
Thank you all.